Well, here we go. It is 6:59 p.m. ish, Mountain Time ish. And I say ish because, as you know, I'm always complaining about this whole damned daylight savings thing. Let's get into that later. Let's talk about something you've all seen. You've been watching broadcast TV, God help you, or even cable television. When an ad comes on, more and more companies are advertising powerful psychotropic medications. Medications with names that rhyme with, oh, I'll just pick one and make it up. Let's call it CRAPLYTA. And this one, like many, is designed to address bipolar disorder. It's just a bunch of crap. We'll get to that later. Let's get to it right now. When the ad comes on TV, you see happy, healthy people. You see a woman with a smile on her face, or maybe she started the commercial like this. I'm always sad. And ends with, I'm out playing golf with my friends. What a great medicine. Ask your doctor for it. You can't buy it over the counter, but these pharmaceutical firms are pressuring patients to pressure doctors to take their medication. I mean, this particular one, let's just call it CRAPLYTA. It's used extensively for treating the mythical bipolar disorder, type 1 and type 2 no less, as well as manic depression and schizophrenia. Now keep in mind that these disorders often lay at the heart of violent behavior, including but not limited to assault, battery, rape, murder, mass shootings, bombing attacks. When the brain goes paranoid and or schizophrenic, it's going to release its stress through any variety of ways, and some of those ways are not very pretty. Look around you today. It doesn't matter what country does or doesn't have guns. They'll use a knife. Ban knives, they'll run you over with a truck, or they'll make a bomb out of fertilizer and kerosene. Do you see where I'm coming from? It's a mental thing. And these drugs that are coming out, my God, they're so dangerous. To me, it's like drinking nitroglycerin and jumping up and down. Now, while there are no established physical, chemical, or anatomical tests to diagnose bipolar disorder, psychiatrists are still just pleased as punch to hand out dangerous drugs and many more in the hope of achieving what psychiatrists want to achieve, what they call ideal brain chemistry. They say all these illnesses, paranoia, schizophrenia, bipolar disorder, come from an imbalance of chemicals in the brain. The problem is they don't know what a normal balance is, so they've nothing to compare it to. They've no freaking benchmark. When they're prescribing these meds, they're literally throwing darts at a board, hoping for the best, not to mention the rather handsome spiffs that these pharmaceutical firms hand out to psychiatrists. When doctors take certain drugs, let's say from ABC Pharmaceutical, then they go on a conference, which is a junket. I know a psychiatrist who got a really nice boat because he used a lot of somebody's, let's use the name CRAPLYTA for the hell of it, okay? Well, as with any medications, any of these that break or violate the blood-brain barrier and screw with your brain, this type can be extremely dangerous beyond belief. Regardless of what anybody says, taking these meds increases your chances of getting the following or experiencing the following side effects. I'm going to list these to you. These are right from the flyers and the medication. Here we go. For pregnant women, it may harm or kill the unborn baby. Birth defects such as Down syndrome, Mongolism, and other limb displacements are among the list of possible and known side effects. So if you're a pregnant woman or you want to get pregnant, you're taking this drug, you're probably better off drinking whiskey. Let's go to the next one. Thoughts of suicide and violence, acting out violently in any manner of fashion, ranging from suicide to harming others. Yeah, like up in a bell tower with a rifle. going into a grade school and shooting it up. If you look at all these mass shootings, all of these horrible things, you're going to find pretty much all of them were on or had very recently come off of psychotropic medications such as our CRAPLYTA. Understand taking it may increase the risk of transient ischemic attack, TIA. It's a ghost stroke. It's a minor stroke, but it increases the risks. How about this one? These are more common. Side effects can include confusion, double vision, headache, inability to move arms or legs or facial muscles, slow speech, trouble speaking, thinking, or walking. And I want to give you that because you're feeling bad because you had a mood swing. I'm going to give you that. I don't know. How about this one? This sounds potentially serious. Difficulty breathing, gasping for breath. I think that's a serious one. How about this one? A fast heartbeat, tachycardia, hypertachycardia, supertachycardia. Your heart just suddenly goes from boom, 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 boom to brrrr. I'll tell you right now, you can't rev the engine in your car at full RPM, foot down, all the way in neutral, and hold it for very long before you break something. Well, the human heart is the exact same way. You rev that bitch up too many times too long, it breaks. And we're not very good at fixing hearts, although we're getting better. Oh, here's one for you. Taking these drugs, side effect, a dangerously high fever. Yeah, your body burns up. How about this one? Spikes or drops in blood pressure. Super high blood pressure, dropping sudden, super low blood pressure. This is not good. Increased sweating. Okay, we all sweat when we work. But how about this? Loss of bladder control. You take the med, and all of a sudden, you're peeing everywhere. Have a glass of milk. Okay, that sounds good. Oh, man, that felt good, but I just peed in the kitchen floor. Loss of bladder control. How about this one? Seizures. Right. Seizures. This time it's like you're not sure why. Seizures that you can't control it. Your body's gone batshit crazy. Your brain doesn't know how to tell it to stop because your nervous system has taken over. How about, this one? Severe muscle stiffness. Now, I've seen this. You can tap on a person's thigh or even a tricep. They're not bodybuilders, but it's literally hard as a frickin' rock. Damage is taking place when those muscles are locking up. How about this? Unusually pale skin. I guess if you're born an albino and this happens, maybe we can see through you and save the cost of an x-ray. I don't know. Maybe not. Here you go. Next one. Number 14 of 29. Exhaustion. I'm talking so tired you can barely get around the house. Also noted as chronic fatigue syndrome. This medication can just suck the energy out of you and leave you just so weak, so tired, you just can't do anything. Next, a very serious condition called neuroleptic malignant syndrome. It's really bad, okay? You just want to stay away from that. Next one, tardive dyskinesia. I love this one, known as TD. You see a lot of ads for drugs to control the TD. Here we gave you a drug to control your mood. It gave you TD. Here's more medicine to control that. It's a movement disorder, always brought about by psychotropic medications such as our CRAPLYTA. TD is lip smacking, puffing your cheeks, rapid or worm-like movement of the tongue, uncontrolled chewing, uncontrolled movements of the arms and legs. All of this, TD, tardive dyskinesia, is forever. We know what causes it. There is no cure. There's no effective treatment. There are some newer drugs out that can help to minimize the symptoms. But once you take that drug your doctor gave you because you were feeling bad and now you've got TD, remember this, even when you're happy, even if your mood survives the treatment, you've got TD. TD is forever. Thank you, Dr. Scott. Let's move along. You know who I'm talking to, you jackass. Let's move along. Weight increase. Okay, weight gain is common with a lot of these medications. How about this one? Increased susceptibility to infection. Get infection really easy because it blows away your white cells. It just kills them. Let's move along. Fevers. I already talked about fevers. Chills. We're talking chills, and those chills can go for hours. You're sweating right into the sofa, and you feel like you're in the Arctic, but it's 80 degrees in the house. Coughing or hoarseness. A lot of people have this side effect from this CRAPLYTA kind of drug where they sound like Alex Jones. And I'm not saying that Alex's voice is because of that, but that's how a lot of people sound when they get on the bad side of this medication. Lower back or side pain. Painful or difficult urination. When you do have your bladder control and you pee, it burns. It burns. It feels like you are peeing boiling water. It burns. Lightheadedness. Sudden unconsciousness. Just suddenly, bam, fainting, hit the ground, you're out cold. Trouble thinking, an inability to focus, an inability to get your head straight, to clear the fog. You can't think. Loss of control over body movements. Necks, arms, legs. Falls, fractures, other injuries. Do you understand what I'm talking about here? I'm talking about taking medications, and this may not happen to you. People will call me and say, I'm taking CRAPLYTA. None of that's happening. Good for you. But somebody is going to suffer this way. You understand? The flyer in just one of these medicines has a flyer that reads like a frickin' book. You think that the patient is going to open it up and look at the chemical balance and drawing and look at the mechanism and then read all the potential crap that can happen? Here's how it goes. You're feeling bad. You want to feel better. They give you something to bump your mood, something like CRAPLYTA or whatever. They give it to you. You're feeling better. And you're taking a chance. You are taking a chance. You're throwing the dice. You're flipping the coin. You're throwing the darts that these won't hit you. Because many of these side effects we talked about, not just the tardive dyskinesia, but the hoarseness, the chills, these things can last forever. You can go the next 20 years faint, unable to use your arms or your legs, having stroke after stroke after, okay, it's a TIA, it's a mini stroke. You know what? 3 or 4 mini strokes is a big stroke. It happens. So all I'm saying is be careful what you take from your psychiatrists, most of whom are quacks like you, Scott, you piece of crap. I can't use the last name, I'll get sued. But you know what? That's just the damned in hell way it is.